Welcome to Maams Medical, your ultimate source for medical learning. This channel is managed by Mr. Ghulam Farooq, an AI technologist with expertise in advanced medical technologies. He is the founder of 5 AI-powered medical YouTube channels, reaching millions of viewers worldwide. Today we will explore anatomy table training. Anatomy table training. A comprehensive guide provides a detailed approach to learning human anatomy using advanced anatomical tables. It covers interactive digital and physical models, techniques for effective learning, and practical applications for medical students, educators, and professionals. The guide includes hands-on exercises, 3D visualization tools, and case studies to enhance anatomical understanding and retention. Anatomy table. Features and benefits. The anatomy table provides an exceptional visual learning experience, offering detailed 3D anatomical models for in-depth exploration. Its key features include interactive dissection, high-resolution imaging, and real-time manipulation of anatomical structures. The benefits extend from enhanced spatial understanding to improved learning retention, making it an invaluable tool for students and professionals alike. By bridging the gap between theoretical knowledge and practical anatomy, it revolutionizes medical education and training. Navigation and basic controls of the anatomy table. The anatomy table is designed with an intuitive interface, allowing users to explore detailed 3D anatomical models with ease. Whether for medical students, educators, or healthcare professionals, mastering its navigation and controls enhances the learning experience. Key navigation features. Touch and gesture controls. Easily zoom, rotate, and pan anatomical structures with finger gestures or a stylus. Layering and transparency. Adjust layers to view muscles, bones, organs, and blood vessels at different depths. Cross-sectional views. Slice through anatomical regions to analyze internal structures in high detail. Search and select functions. Quickly locate specific body parts or systems using the search bar and selection tools. Basic controls and functionalities. Interactive dissection. Virtually remove or isolate structures for a deeper understanding of anatomy. Multi-angle viewing. Rotate models 360 degrees to examine complex anatomical relationships. Real-time annotations. Add notes, labels, and markers to highlight key structures during study or presentations. Comparison mode. View normal and pathological conditions side by side for diagnostic learning. Integration with medical imaging. Overlay CT scans, MRIs, and X-rays for clinical correlation. With these features, the anatomy table bridges the gap between textbook learning and real-world applications, making anatomy study more interactive, efficient, and engaging. Dissection techniques. Layer-by-layer exploration. Virtual dissection provides a systematic and interactive approach to studying human anatomy. By removing anatomical layers step by step, learners gain a clear understanding of structural relationships and functional integration. This method enhances spatial awareness and deepens comprehension of human body organization. 1. Skin and superficial fascia. The outermost layer, including the epidermis, dermis, and subcutaneous tissue. Key for understanding surface landmarks, sensory innervation, and fat distribution. 2. Muscles and vessels. Reveals muscle groups, tendons, arteries, and veins. Focuses on muscle function, blood supply, and interconnections between systems. 3. Nerves and deep tissues. Exposes peripheral nerves, lymph nodes, and deep connective tissues. Highlights neural pathways and their relation to muscles and organs. 4. Skeletal structures. The final layer showcasing bones, joints, and articulations. Essential for understanding body support, movement, and structural integrity. This layer-by-layer exploration bridges textbook learning with practical application, making it an indispensable tool for medical students and professionals. Advanced features. Annotations, quizzes, and case studies. Enhance your anatomical learning with interactive tools that provide a deeper and more engaging experience. These advanced features support personalized learning, self-assessment, and clinical application, making the anatomy table an invaluable educational resource. 1. Annotations. Add custom notes, labels, and markers to anatomical structures. Highlight key areas for revision, teaching, or research. Save and share annotations for collaborative learning. 2. Quizzes. Test your knowledge and retention with interactive multiple choice and labeling quizzes. Receive instant feedback to track progress and identify weak areas. Customize quizzes based on specific body systems or anatomical regions. 3. Case studies. Explore real-world clinical cases to apply anatomical knowledge in a practical context. Compare normal and pathological conditions through 3D visualization. Improve diagnostic and critical thinking skills by analyzing complex medical scenarios. By integrating annotations, quizzes, and case studies, learners can actively engage with anatomy, reinforce their understanding, and enhance clinical decision-making skills. These tools are ideal for students, educators, and medical professionals alike. Utilizing the anatomy table for different learning styles. The anatomy table is designed to accommodate diverse learning preferences, ensuring an engaging and effective educational experience. By adapting its features to individual needs, educators can create an inclusive learning environment that enhances comprehension and retention. 1. Kinesthetic learners. Engage through interactive dissection, allowing hands-on exploration. Rotate, zoom, and manipulate 3D models to study anatomical relationships. Perform virtual dissections to understand layers and structures dynamically. 2. Auditory learners. Benefit from integrated audio explanations and guided lessons. Use voiceover features or instructor-led discussions to reinforce concepts. Participate in group discussions and verbal quizzes to solidify learning. 3. Visual learners. Learn through detailed 3D models, high-resolution images, and animations. Explore color-coded structures to easily differentiate anatomical components. Utilize annotations, labels, and visual overlays for enhanced clarity. By leveraging these features, the anatomy table ensures personalized and immersive learning, making anatomy education more accessible and effective for all students. Troubleshooting and best practices for optimal use. To ensure the anatomy table functions efficiently, follow these troubleshooting tips and best practices. Proper maintenance enhances performance, prevents technical issues, and maximizes learning potential. 1. Regular updates. Keep the software up to date to access new features and improved functionality. Install firmware updates to enhance system stability and security. Check for compatibility issues with other connected devices or software. 2. Proper calibration. Regularly calibrate the touch interface to maintain accuracy and responsiveness. Adjust sensitivity settings for precise control during virtual dissections. Ensure the display is aligned correctly for optimal 3D visualization. 3. Optimal lighting. Place the anatomy table in a well-lit environment to reduce glare and enhance visibility. Adjust screen brightness and contrast to prevent eye strain and improve clarity. Avoid direct sunlight or harsh reflections that could interfere with touch sensitivity. 4. User training. Provide training sessions for educators and students to ensure effective use. Familiarize users with navigation, tools, and troubleshooting protocols. Encourage interactive learning practices to enhance engagement and understanding. By following these best practices, users can ensure seamless operation, extended device longevity, and an optimal learning experience with the anatomy table.